to the Mind Body Podcast, your rebellious podcast with me, your host, Maria, where it is all about a strong body, calm mind, healing, and fully living. And today we have a treat all the way from London, and that is Dr. Samantha Tross, a consultant, a hip and knee orthopedic surgeon. Oh, juicy stuff coming up. Thank you so much for joining us, Dr. Samantha, especially considering the time difference.
Maria, it's a pleasure to be here. Thank you for inviting me on your wonderful program.
Yes, thank you. Well, Dr. Samantha, let's dive right in. We got to talk about those hips and knees. So
yes.
Let us learn about Dr. Samantha. Give us 3 words that give us a little bit of a backstory of who you are and tell us a little bit more about each.
Right. Well, who am I? I am a Guyanese-born orthopedic surgeon practicing in London. I've been a consultant for 18 years. I've come into a specialty that really lacks diversity. So when I became a consultant, only 3% of orthopedic consultants in the UK were female.
Wow.
And that number is only just over 6%. So we still have a lot of work to do. So I'm in a field where I'm very much in the minority. And of course, we haven't got much women. We haven't got much other diversity either. And I became the first Black female orthopedic consultant in England when I became a consultant in 2005.
Congratulations.
Yes, someone who is not afraid to face challenges. That's who you have sitting in front of you.
I like that. That is why you're here. We want rebellious spirits. Look at that. Yeah. All right.
Yes, so the actual job, so I specialize in, as an orthopedic surgeon, we treat conditions of bones, joints, tendons, structures that lie adjacent to the bones. And in your training, you train in all parts of the body. And then we are encouraged to specialize in a particular area. And so I specialize in hip and knee surgery, specifically in arthroplasty, as in joint replacement, because one can also specialize in sports injuries, but I'm more in the arthroplasty side of things.
Okay. Why hips and knees?
It's a wonderful specialty. You know, with hip surgery in particular, you have your intervention and you see the results very quickly. We're now moving towards day case surgery. So a patient comes in terrible pain, you give them a joint replacement, they're going home within a day or so, and significantly improve. Now, obviously, when they first leave hospital, they might still be using a crutch, but very quickly, they're moving and getting back to normal life. And so I like that quick reward that one gets. Knee surgery takes a little bit longer to recover from, but also you see the significant impact on a patient's lifestyle.
So let's go kind of like before surgery. What can somebody do to prevent not having to do a hip or knee surgery? Let's talk about prevention first before we
Yes, definitely. I think we should. We definitely need as surgeons to focus on that. As much as we love to operate, we need to make sure that people remain well, because we're doctors first and foremost. So it's important that one keeps one's weight under control, because if you have excess weight, then there's more stress on the joints. It's important to keep the joints moving and active, keep the muscles well toned, yes, and moving the joints helps improve the lubrication and so on around the joints. That's important. Pay attention to your footwear, because that can have an impact on the alignment of the limb. And then if that's not adequate, then not only will you have pain in your limbs, your lower leg, your hips and your knees, but it'll go up towards the spine, etc. And then when you undertake activity, which I'm encouraging you to do to keep the weight down and keep the joints moving, you've got to do it sensibly. Make sure that you don't go and use equipment that you're not properly trained to use. Before you get going, you want to stretch the muscles, get them warm. And then when you finish, you want to cool down, stretch appropriately. And of course, you have to have a balanced diet. Because you want to make sure that the body processes are functioning well, that your bones are turning over well. So some people may have diets where they don't want to have dairy. You have to worry about how they're going to replace the calcium supplements. Important to eat foods with high antioxidants, such as berries, green vegetables, and so on. They help to fight disease processes. So that's how you really prevent injuries.
I do have to say, like, on my heart. Oh, the good stuff that I tell my clients. So now hear it from a doctor. You got to keep moving, and it's all about lifestyle, right? It's a holistic lifestyle.
Definitely.
And it's interesting that you bring up, and you're not a foot doctor, right? You're hips and knees.
No, exactly.
I always tell my clients, and I give them homework, and we do a lot of work, is the feet. People don't think about their feet. And I always say the feet are the baseline of your tower. So if the baseline of your tower is off, everything, knees, hips, spine, shoulders, neck, everything.
Exactly. So Maria, you've been telling them the right thing. I fully agree with you.
See, I love that. Okay, and you brought up nutrition, which again goes back to lifestyle, right? It's a lifestyle. Stay mobile, lubricating the joints, making sure you stay active, muscles stay strong so you don't atrophy, especially at age. All of these so important things. And honestly, I think sometimes we think they're difficult things to do, but like even going for a walk, like investing into a good pair of shoes, like these are things that we can do to stay mobile and healthy and keep those. Yeah.
Exactly that.
Love it, love it, love it. How about the strong core? Do you have any thoughts on the strong core? Because that's my specialty.
Oh, absolutely important. I mean, you're giving them all the pearls, and you're quite right. And I'm delighted to hear to come and endorse everything that you've been saying. It's so important to have a strong core. Because look, all the muscles work synergistically. You have a weak core, then the other muscles are trying to compensate, and that's how you're going to get yourself injured. So when you think of the spine, the spine is supported by the abdominal muscles and then the back muscles in the back. If the core is weak, the back muscles are having to work extra hard. The spine is getting extra stress. And then the other muscles around the pelvis, trying to stabilize the pelvis, the glutes, the hamstrings, and everything, the quads, everything there, they all work together. And when one's out of kilter, you're putting stress on the others.
That's what I say. A dysfunction in one place is a dysfunction everywhere. So that is exactly what you're saying. So let's talk about your exercising, you're eating well, you're getting older, but there is like that nagging pain that's still there. When is it time to see an orthopedic, maybe surgeon, a doctor? What are some warning signs? Let's talk specifically hips and knees.
I think it's always very reasonable if when you're first getting pain to first of all modify your activity. So look at the way you're doing it. Can you do it in a different way? So try that first. Then you can, apart from modifying it, perhaps do it for a shorter duration of time. Yeah. And then if you're still getting pain and things are not settling, then I think it's very reasonable to see a physiotherapist and to try getting advice from that end. But if symptoms fail to respond to physio, then certainly one should seek advice. But there are certain what we call red flags to look out for. So if you get severe pain that is rapidly progressing, then I think you should seek medical intervention. If you have any associated neurology, then I think about seeing someone. If you have associated temperature, so systemic symptoms, you should think of seeing a doctor earlier. If you suddenly notice the marked restriction in joint movement, then that is something to see someone about. And if you suddenly notice a progressive shortening in limb length, your legs getting short, you suddenly notice your trousers are scuffing the ground when they weren't before, it's flayed on one side and not on the other. Those are the kind of red flag signs that I would say. Now, now I was talking about the leg in general. Now, with regards to the knee specifically, if you experience what we call locking, for us, locking means an inability to straighten the leg. So you try to straighten it and it just won't straighten. But equally, if you got restriction of flexion, if there is a history of instability, so you don't feel confident in your knee, or the knee gives way on you. And if there's massive swelling as well, and all the other things I mentioned previously, these are what we consider our red flag signs. And that's when you would come and see someone rather than starting off with physio, etc.
Yeah. A couple of great points about modifications, for example, right? Because I think as a coacher, generally we are taught to push through the pain, right? Push through the pain, you get stronger. And one thing I tell clients is don't push through the pain. That's your body's telling you something is not right, so there is no need to push through it, right? It's one thing to feel muscle burn, but it's a different to be in pain. And you mentioned neurological, effects. I tell people like no tingling. If you ever feel any kind of tingling, you stop right away because you don't want to affect your nerves, because that is a big deal, right?
Yes, indeed.
And then another important thing that you mentioned was range of motion. I think sometimes we get into a routine that is very repetitive, and a particular joint, like maybe the hips, right? They move only maybe into a flexion. So like you're lifting your leg up, right? But maybe
Yes.
you don't go into an extension, or maybe you don't open out or come back in, right? And it is important to stay active through the full range of motion into a joint, whether that's the knee, the hip, the shoulders, any joint that's out there, right?
Exactly that. Exactly that.
And then to the point that you make, if your body is screaming for help, please go see the doctor. Don't push through the pain.
No,
Because,
definitely. Yeah.
yeah, because you mentioned something else, which we see a lot in elderly. They start seeing problems with balance and stability. And I always tell my older clients, sitting down into a chair, hoping that the chair will catch your weight is not a good strategy. So you want to make sure that you have, the proper biomechanics and strength or support, maybe hold on, to sit down versus just throw yourself.
Just flopping yourself into it. Yes, exactly. I agree with you entirely.
Yeah.
I agree.
So let's go now. You have had the surgery.
Yes.
What you do after the surgery to make sure that you make full recovery?
Well, okay. So, I mean, a little bit before that, not everybody who has pathology necessarily will require surgery. One has to be fit enough to undergo the operation, and surgery is really tailored to the patient. So it's not sort of one size fits all. So when we putting in our implants, there are different ways of putting it in, either with or without cement, the different size of the components, etc. So there's a lot of things that are individually tailored for a patient, and you will only have the surgery if it's deemed appropriate, because we want you to have a good outcome. Now, you've had your surgery. Surgery is just the beginning of the patient's journey. So when my part is finished, it's just the beginning for the patient. And I can't stress the importance of the exercise that comes afterwards, because you can have a brand new shiny joint. If you don't rehab properly, then it's no good to you. But a lot of people focus on the rehabilitation after surgery, and I'm trying to impart the knowledge that rehabilitation prior to surgery is as important. Because, for instance, in a knee replacement, the most important predictor of post-operative range of motion is pre-operative range of motion. So if you're very stiff beforehand, putting in a new prosthesis is not going to necessarily just be the magic cure. You've got to stretch the ligaments and make sure they're ready to receive the prosthesis. So it's about going back and doing adequate rehabilitation. Sometimes if you push yourself and you go too fast, too quickly, that can cause a lot of inflammation of the ligaments and tendons around, and that can sort of slow you down. So it's about doing it in a timely, steadily progressive manner.
Yeah. Really like what you said about preparing your body for surgery, because, and I don't know how it is in the UK versus the United States, but the United States is a very sedentary lifestyle for the most part, right? Stereotype. Yeah. And I think people think, oh, I'm just going to go get a new hip, and I'm still going to continue with my, couch potato lifestyle. I'm not going to move. I'm going to continue eat poorly. I'm not going to sleep. I'm going to be exposed to high levels of stress. And they think that just getting the surgery, it's going to be a game changer.
Yes.
And not conditioned before that, to your point. And then I also love what you said, that you have to listen to your body with recovery. A lot of times there's discomfort, there is the fear of pain. Actually, I would love for you to talk about that, because I see that in a lot of people who are in pain, they're scared to move. And they not to move because they're like, this is going to hurt. But you can be very gentle and do modification and go small range of motion to still help with mobility.
Exactly. Exactly. And that's why you see a lot of it is about the counseling of the patient before the surgery. I think that's absolutely key. And I really impart on them the knowledge and the importance of getting that movement. And if they want to have a good outcome, they have got to move. You've got to move through the pain. I don't want to hear, oh, I'm in pain. I can't move. But obviously, as a surgeon, we have to do as much as we can to improve the patient's pain, because we know, the people in pain don't necessarily want to move. I mean, that's a natural thing. And so for me, when I'm undertaking the surgery, I inject local anesthetic, starting from the bone outwards. So really anesthetize around the bone, the capsule, where there's a lot of nerve endings, then the muscle, the tendon, and then the skin finally. And then work very closely with my anesthetist to ensure that the patient's pain control is adequate. So apart from the articular and periarticular injection. It's about making sure they have adequate oral and intravenous painkillers on board as well. But yes, patients are spent a lot of time counseling, and I have an app, which the light is very poor there.
Yes, and you can send that to me and we can share
it. You can share that, but it's an app for them to download, and on there it has the exercises for patients. It's a lot of information about which I give them a chance to read so they can get themselves prepared, because when patients come for consultation, you can impart a lot of knowledge there, but sometimes they're nervous. And you don't know, they might only take in 50%, they might be 20%. You don't know what state of mind. They might look like they're attentive, but a lot is not being taken in. So it gives them a chance to go back and digest it. And because even in a consultation letter, there's only so much you can write in a letter. So with this app, they can go, they can take their time, they can pause, they can discuss with their family, there are videos on there showing them the exercises, they can familiarize themselves prior to surgery and so on. But yes, it's very important that we as doctors, surgeons, that we work hard to ensure that the patient's pain control is satisfactory. But it's important that we also educate them and let them know the importance of early movement.
Yeah. What do you tell to elderly patients who are slowing down, are not in the mood to move, it's too hot, it's too cold? Then there is also, you probably deal with that, there is a lot of fear of falling because they don't feel stable.
Yes.
It's something I constantly have to reinforce to my, especially elderly, you have to keep moving, you have to keep moving, you have to do something every day. And some of them are honest. They're like, I don't want to do anything. And I'm like, no, that is not a good choice. Well, that is a choice. It is just not a choice.
Yes, no, sure.
Over time, if you stop moving, things will atrophy, right? The body that does not move will get weaker. And
exactly.
If you're older, it comes a stage where there's no going back, right?
That's right. That's right.
What is your advice for people who are, could be young too, who are immobile?
Well, part of being a surgeon is of course choosing the right patient, and that's why I said to you, not every person with disease is a good candidate for surgery. And if you come to me and you're someone who clearly I can see is demotivated and not going to move, then I strongly say to you, well, is this the right operation for you? Because there's no point going through all of that. It's a very expensive procedure. There's trauma to the body, and if you're gonna go through all that for nothing, then what's the point? It's about selection of the correct patient. Now, obviously, as one gets older, particularly if you've got multiple comorbidities, you've got other joints that are making, things are going to be difficult. We understand that. But it's about checking that the patient still has the motivation. It's about modifying the exercise in a way that they can tolerate it. And so we have to also, that's why I say treatment is individualized. You have to adapt according to the patient's needs.
Yeah. And that is what I tell people. Yesterday I was teaching a group class and somebody said, oh, my sciatica is bothering me, but I can push through for most of it. And I was like, you do not push through sciatica pain, right?
Yes.
That is not a joke. You decrease the range of motion, you use your core, you need to, you stop. And we go through what other modifications can we do. But you do not push through, it feels uncomfortable, it feels painful, I feel tingling. You do not push through.
Don't push through that, yes, exactly.
Yeah. Very good. Well, Dr. Samantha, do you have any favorite quote or a piece of advice you would like to wrap up with?
A piece of advice, my goodness. I just think that, we only have one body. That's what I would say. And it's up to us to take care of it. As a doctor, I can help you, but ultimately it comes down to you. And in order to prolong and have a healthy life, then we have to look at all aspects. Keeping healthy in terms of looking at the nutrition that we put into our bodies, that's very key. Making sure that our bodies get enough rest. And then looking after our joints, as I said to you, the way that we look after our joints, making sure that we use equipment that we've been taught how to use properly, that it's within our capacity. Because even something that's light, used in the wrong way, can cause damage. Yeah. So it's about using things effectively. And finally, as we talked about, the importance of footwear, which I think a lot of people overlook.
Yeah. Speaking of footwear, let's throw, what are a couple of things to pay attention to when picking
Well, it's important that you have the arch of the foot is well supported. That's very key. And so, you know, if you when you choose your shoes, to check and make sure that, I mean, yes, of course, you can wear a completely flat shoe for a short period of time, but that should not be done consistently or persistently, I should say, because that's going to lead to problems. So the support is important. It's going to have a nice flexible sole to allow the normal cadence of the foot, that you can do your toe, you know, heel strike, then toe off in a normal way. And that has got enough room to accommodate the foot, and that it's not too tight to cause pressure areas on the foot. Those are the key things. Now, no one's saying that one can't wear a heel. Of course, every woman wants to wear a little heel and so on. But you know, if you're going to wear shoes where you're putting all your weight on your toes for a prolonged period of time, that's not going to do you good. But of course, you know, every girl likes her heels, and I'm not telling people not to use short periods of time. Everything in moderation.
Yes, everything in moderation. I completely agree with you. And I would say, you like, especially as people age, we see a lot of like the toes get so tight, and sometimes we see the toes like on top of each other. And
yes,
you gotta stretch them, you know, you gotta keep that base wide, because that's your stability, that's your base. Shoes which are like squishing your toes in.
Exactly. Not good. Not good.
Yeah.
So no, it's been an absolute pleasure. I just want to let the audience know that, I mean, I am a consultant here in London, and I work out of the Cromwell Hospital, the Harley Street Specialist Hospital, the Clementine Churchill in Harrow, and I can also be found at the Chiswick Medical Centre. And I would be more than happy to look after you with any of your hip and knee problems. I can promise you a first-class service, which is individualized to you, because you know the patient's outcome is my priority.
And Dr. Samantha, how can people connect with you?
Yes, so I'm on Insta. I mean, I must admit, you know, because of my work commitment, I am not on social media as perhaps, you know, I need to improve that. But I am on. It used to be called Twitter. Is it still called Twitter? What is it now?
I don't know. I'm not on Twitter. Sorry.
Black Cross now. But anyway, I'm on there. My at Samantha Tross. You know, that's my hashtag. I'm on Instagram. Joint replacement surgery. JR Surge. And where else? Where else is there? Of course, LinkedIn is very much a profession, and that's how we met, on LinkedIn. And that is where I spend most of my time, actually, is on LinkedIn. So those are the main areas. Facebook, I only keep for my private. I do have actually a work Facebook, a joint replacement surgery Facebook. Again, not on there as much. LinkedIn is really where I put my focus. But hope to connect with you all out there.
Yeah. And before we wrap up, I do have to ask you, what is your definition of rebellious?
Ooh, what is my definition of rebellious? Now, you know, the problem is I've been too good most of my life. I'm now in my you know, I'm in my mid-50s. I'm now learning to be rebellious. And I'm trying to think now.
Too late.
It's never too late. Exactly. It's never too late. My goodness, now you've caught me rebellious. I don't know. I need to be more rebellious. I need to hang out with you a bit more, Maria.
Yes, okay, you got it. I can help you being rebellious. You help me with knowledge, I'll help you be rebellious. How about that?
Perfect. We're going to connect up on LinkedIn, and yes, I'll get some knowledge from you.
Dr. Samantha, you are a pleasure. Thank you for making time.
It was wonderful. Lovely to meet you, to talk to you. Take care.
Thank you so much for listening in. Let us know if you have any questions. And of course, you know, stay rebellious. See you next time. Bye. Can't get enough of those rebellious conversations? Do make sure you subscribe, like, and share with your friends.